Hi, in this video, I'm going to talk about vestibular migraine, help you to treat vertigo naturally. Well, as you can see, a vestibular migraine refers to an episode of vertigo in someone who has a history of migraines. People with vertigo feel like they, or objects around them, are moving when they're actually not. Vestibular refers to the system in your inner ear that controls your body's balance. However, migraines are often associated with painful headaches, but vestibular migraines are different because the episodes commonly involve no headache at all. Many people who get classic or basilar migraines also experience vestibular migraines, but not all people. In fact, vestibular migraines may last only a few seconds or minutes, but sometimes they persist for days. Rarely do they last longer than 72 hours. In most cases, symptoms last for a few minutes to several hours. In addition to vertigo, you may feel off balance, dizzy, and lightheaded. Moving your head may cause those symptoms to worsen. A vestibular migraine occurs in about 1% of the population. It's the most common cause of spontaneous vertigo episodes. Children may also experience episodes similar to vestibular migraines. In children, it's known as benign paroxysmal vertigo of childhood. Those children are more likely than others to experience migraines later in life. The main symptom of a vestibular migraine is an episode of vertigo. Usually it happens spontaneously. You may also experience symptoms including feeling imbalanced, motion sickness caused by moving your head, dizziness from looking at moving objects such as cars or people walking, lightheadedness, nausea and vomiting as a result of the other symptoms. You know that doctors aren't certain what causes vestibular migraines, but some believe that the abnormal release of chemicals in the brain plays a role. Some of the same factors that triggers other kinds of migraines can trigger a vestibular migraine, including stress, lack of sleep, dehydration, weather changes, or changes in barometric pressure menstruation. Certain foods and drinks can also trigger a vestibular migraine: chocolate, red wine, aged cheeses, monosodium glutamate, processed meats, coffee, sodas with caffeine. Women are at a greater risk for getting vestibular migraines. Doctors suspect that vestibular migraines run in families, but studies have not yet proven that link. So, how is it diagnosed? Well, vestibular migraines can be tricky to diagnose because there's not a clear-cut test for it. In order to treat you best, your doctor will want to rule out these other conditions that could be causing the symptoms: nerve irritation or fluid leaks in your inner ear, transient ischemic attacks, also called mini-strokes, Meniere's disease, benign positional vertigo, which causes brief periods of mild or intense dizziness. You see, the same drugs used for vertigo can provide relief from vestibular migraine episodes. These drugs help treat dizziness, motion sickness, nausea and vomiting, and other symptoms. Of course, you can reduce the chance that you will get a migraine by avoiding the foods and drinks that may trigger them. Pay attention to what you've eaten, you may notice a pattern. Keeping a food diary can help you identify something that upsets your body and leads to an episode. In fact, lifestyle changes can also help. Make sure you're getting enough sleep and rest, exercise regularly, drink plenty of water, take up stress-reducing activities like meditation and gardening. And if menstruation is a cause of your migraines, it may help to take a water pill and avoid eating salty foods. That's going to be the video. Thanks for watching, and don't forget to click link below description to learn more about how to treat your vertigo easier and heal it naturally.